Hello, welcome to the last part of this learning series with tips on preparing and submitting the 510K. In parts 1, 2, and 3 of this learning series, on how to gain clearance of a new device via the 510K pathway, we covered device classification, selecting a predicate, collecting and organizing the required data. You have a choice of submitting your 510K in the traditional format, or using the globally harmonized format abbreviated STED. If you are interested in using the STED alternative, see the FDA guidance entitled, "A Pilot Program to Evaluate a Proposed Globally Harmonized Alternative for Pre-Market Procedures." We will focus on the traditional format. Start by preparing your submission document format. We recommend that you include all 21 sections recommended by the FDA to be included in a traditional 510K, which covered in Part 3 of this 4-part series. In some instances, the information in a particular section may not apply to your device. In order to make the FDA reviewer's job easier, we recommend you retain the section headings in the sequence listed. If you believe a section does not apply, state the section does not apply or NA under that heading. For example, if your device does not contain any software, we recommend you list NA under the section 16 software. Sometimes a client will ask to prepare and submit a deficient 510K in the hope that the reviewer will overlook the missing requirements. Wishful thinking just doesn't work. You really do need to submit a complete application in order to obtain marketing clearance. To facilitate FDA review of the data, analysis, and conclusions in the application, you should be sure the submission is a logical presentation of the data, your test results and analysis is scientifically sound, the relevance of the test program to the device and intended use is easy to discern, and the summary report of the tests is complete. A description of the tests and the results obtained are essential. Reasonable and sufficient details of all test procedures and results should be included. Now let's discuss sections 11 through 21. By far the most difficult section is section 12, substantial equivalence discussion. In the substantial equivalence section, you need to identify the predicate, its trade name, model number, the predicate owner's name, and the 510K number. It is best to insert copies of the summary documents, downloaded from the FDA 510K database, and the predicate labeling and product literature you collected when you scrubbed the internet, which was covered in the previous video. You will need to provide a detailed comparison between your device and the predicate in section 12 of your submission. It needs to be sufficient to demonstrate the substantial equivalence of the devices, as applicable, in terms of indications for use, technology, and performance specifications, including testing. A table should be part of this section and address similarities and differences in the following areas, if applicable: intended use, indications for use, target population, anatomical sites, where used, such as hospital, home, ambulance, etc., energy used and/or delivered, human factors, design, performance, standards met, materials, biocompatibility, compatibility with the environment and other devices, sterility, electrical safety, mechanical safety, chemical safety, thermal safety, and radiation safety. Do-it-yourself submissions often fail to include appropriately defined performance testing in sections 18, 19, and 20. All submissions should generally include a list of the specific bench tests conducted, a description of each test protocol with test objective, test articles used, methods and procedures, predefined acceptance criteria, a summary of the results, a description of your analysis, and a discussion of your conclusions. Now, let's go to the detailed substantially equivalence flowchart. This detailed substantial equivalence decision-making chart will serve as an interim review. Starting with question 3, does new device have same indication statement? In question 3, if the answer is no, then question 4, do the differences alter the intended safety and effectiveness? The answer to 4 must be no. Questions 5, Does new device have same technological characteristics? If the answer to question 5 is no, then question 6, like question 4, asks if the difference affects safety or effectiveness. 6 must be no, or else you will not receive 510K clearance. Question 7, are the descriptive characteristics precise enough to ensure equivalence? If this answer is no, you will need to revise your submission to make sure the performance data submitted fully demonstrates substantial equivalence for safety and effectiveness. Once you have completed the flowchart, and sections 11 through 21 are complete to your liking, we recommend going back and completing sections 2 through 10, and be consistent in your use of terminology. What you wrote in 11 through 21 should read the same as the same topic covered in sections 2 through 10. Section 2 should include Form FDA 3514, the 510K cover sheet. Section 4, Indications for Use statement, requires a special form UCM 084407. It can be downloaded from the FDA.gov website. The indications for use statement should be exactly the same as the predicate device, or at least very similar. In Section 5, we recommend always using the summary versus the 510K statement. For more detailed information on the other sections between 2 through 10, go to the FDA website and enter UCM 142651 in the search field. Open the 510K contents document and follow the detailed instructions provided. At this point, the only things left are pay the user fee and paste the medical device user fee cover sheet form FDA 3601 in your submission document, and then insert a table of contents. In the event you made declarations of conformity to one or more standards in Section 9 or anywhere else in the document, then you will need to complete the form FDA 3654 for each declaration. Finally, before sending your 510K to the FDA, we recommend you have someone other than yourself review your submission document. They should use the screening checklist for traditional and abbreviated pre-market notification 510K submissions. The checklist is available from FDA.gov. Use the search term UCM 071369 to download the document. This completes the learning series on 510K clearance. As always, any one of us at FDA Compliance Help would be happy to answer any other questions you may have, at no charge. We would also be delighted to discuss your specific situation and provide you with a proposal to help you get your device to market as soon as possible. Thank you for listening.